We have already made a video about facial cosmetology after BDS, but there is a lot of confusion regarding which aspects of facial cosmetology a dentist can work on and which they should completely avoid. So, to help us out, we are speaking with Dr. Rajat Bhandari, who's an eminent clinician and will guide us what his opinion or perspective is when it comes to facial cosmetology for dentists. He is the director and chief mentor at the International Academy of Aesthetic Training. He's the president of Asia Pacific Laser Institute Taiwan, a director of Aesthetic International University. And most importantly, he's an international trainer who has helped train doctors across the globe. Hello, Dr. Rajat sir. It's amazing to be having you here with us today. You're one of the inspirations for many people getting into facial cosmetology after BDS. You're the people who were one of the innovators and the pioneers in getting into this field. So there are a lot of people with a lot of queries when they start their career. So we thought,
Mhm.
who other than you to best answer their questions? So my first question to you, sir, is a lot of people who are already dentists are interested in getting into facial cosmetology. They are scared because a lot of people tell them that facial cosmetology is not for dentists, it's for dermats, it's for
Mhm.
MBBS doctors. So
Mhm.
what would be
Mhm.
your words to them, sir?
See, actually, cosmetology is a very big word. Like it encompasses a lot of things, starting from over-the-counter products like sunscreens, basic Fair and Lovely cream and such, which you and me can go and buy, to specialized treatments. So, cosmetology is an umbrella term, and uh, in my experience, as a dentist, having knowledge of deep knowledge, I must say, of the head and neck area. We study anatomy much more than what our regular MBBS counterparts do. Okay, and then there are every year we are studying anatomy in a certain subject, and we are dealing with diseases of head and neck. We're giving anesthesia. We are anesthetists also of this area where we work in. So I feel that we've sort of we've not understood what is our scope of practice in terms of choosing what part of cosmetology. I will not say cosmetology. I call this as um, non-surgical injectable implants or injectables, okay, and neuromodulators. So I don't see any problem when we are working, for example, for neuromodulation. I have a patient who has a strong masseter or strong temporalis. These are muscles of mastication. I mean, I would not send it to any other specialty to relax them, for example. Or if I'm doing implants like you do implants and I have a bruxer, you know, I would be the one who understands masseter or temporomandibular joint, and I want my prosthesis to be successful. So I'll have to deal with whatever sort of imbalance in the musculature there is, right?
Yes, sir.
Then when we study about anatomy, and we also study about growth pattern, because there are certain diseases like prognathism, retrognathism, smaller maxilla, for example. So when we are dealing with dental implants, we are drilling in the bone, we are drilling in maxilla and mandible. And when we are dealing with, for example, retrographism, I must be able to give my patient an option which is a non-surgical option to make them look at least normal. Okay, to give them a little
Understood,
bit
sir.
of enhancement of chin, for example. So if I have to enhance someone's chin non-surgically, I have injectable implants for that, right? If someone is aging in the face or they have smaller maxilla, for example, I would restore this maxilla with injectable implants. So primarily, I would say that if you want to enhance your scope of practice, these are the things. For example, this is the part of aesthetics or cosmetology, or I might not even say aesthetics. It's sometimes therapeutic also to be done by dentists, because who better than a dentist to know all these things, to know about masseter, to know about temporal. And it's not a fight of being a dentist being, if we will use the word cosmetology, cosmetology is not a title given to any medical specialty per se.
Yes.
Okay. So we are, so if, there's a doctor who's dealing with a certain situation. Okay. And if it comes, if that case comes to me, for example, if a case comes to me for gummy smile, I have to fix that gummy smile because I don't want her gingiva to get dried, okay, and
Yes,
be
sir.
prone to other periodontal or gingival conditions, for example.
Yes,
So
sir.
this is nothing more than common sense. So, but when we cross the line, when we try to project ourselves as skin doctors, for example, then that's not right. I mean, I'm not a prescriber for skin ailment medicines. Okay.
Understood.
I don't have knowledge of scalp to give anesthesia there or to, do hair transplant. I don't. I mean,
Understood, sir.
that's not in my scope of practice. A scope of, and see, understanding scope of practice is very important. Like, for example, I'd forwarded a document from UK where they have a whole paper on scope of practice in dentistry, where not even the dentist, but other people, who work with dentistry, like dental nurses, dental assistants, all
Yes.
these people, their scope of practice is defined, and they clearly state for dentists, dental implantology and facial cosmetic injections as,
Okay.
what you can enhance yourself to.
Understood, sir.
But if I start working with hair removal laser and such, then obviously it's sort of encroachment, using lasers which are meant for skin diseases or skin resurfacing. So if somebody has resorption occurring in maxilla, so their cheeks will look flat, they'll have nasolabial folds, and that is what we
Understood.
restore. We restore what we've lost on the bony side more. So it's also wrong to say that this is a skin problem. You understand?
Understood. Yes, I understood.
Yeah.
So you're
Yes.
telling you should know the scope of where you can do facial cosmetology and where there to draw the line. So now you
Yes.
spoke
I
about
feel as a dentist,
injectables.
yes, it's mainly injectables. Yes.
Okay. So what is your opinion about fillers and other kind of things
So
like
fillers
lips?
come in the fillers. They come in the category of injectable, non-surgical injectable implants.
Okay.
Like you drill bone in the maxilla, you're drilling bone. You're making you're doing sinus lifts, for example.
Yes.
No ENT surgeon tells you not to do it. You're not scared from ENT people or what people will say and stuff. Similarly, we are drilling bone. Orthopedician will not say anything to you. It's
Understood.
common sense. Okay. Yes, I can work in area where I give anesthesia. And
Okay.
see, the if you see the wholesome definition of dentistry,
Okay, sir.
it's restoration, reconstruction, rehabilitation of teeth, jaws, orofacial hard and soft tissue, and associated structures with knowledge of working of muscles of mastication, deglutition, and phonation.
Understood, sir.
Unfortunately, unfortunately, it's a common perception that dentist is a doctor of teeth. For example,
Yes.
you're a periodontist. You work with soft tissue. You do soft tissue plastic work in the gingiva, right? In the
Yes, sir.
periodontal area. You do free gingival grafts. You take graft from the palate,
Palette.
for example. Yes. So that's a separate discussion altogether. So it's not just about teeth; it's about this whole area. That's why we are taught. I mean, it's so many years that we learn dentistry. There are so many subjects we have to study. We have to study general medicine, general surgery. You understand? So
Understood, sir.
it's
So
not
people
a
basically have
if
forgotten what comes under dentistry. They end up thinking dentistry is about teeth. So some of them do not
only
think that
yes.
injectables and everything are not a part of it.
Yes, we should not think of ourselves as tooth mechanics.
Understood.
That would be a mechanical work, right?
Yes,
So
sir.
then I would have to give anesthesia also in that tooth only, like not in the other part. Then maybe someone else gets offended, for example, that why are you working close to the sinus, for example, or why are
Understood.
you getting close to the nerve, for example? We work in this whole area. That's it. You know.
Understood. So,
Mm-hmm.
so now that we know where the line is drawn between what we can do
Uh-huh.
and what we should not do. So if someone
Mm-hmm.
is planning to start, what all things
Mm-hmm.
you think they can try out when it comes to related facial cosmetology? One is injectables. What are the other things they can try when they're starting?
So injectables is a very huge thing. It's not just injectables. It's many
Okay.
things. And if you would see my Instagram post few days back, I'd posted I had some plastic surgeon attend my training, and she had been in many different trainings. And she told me that this is the training where she actually learned how to hold a syringe. She
Understood.
said, I've been to so many trainings, but this is where I've learned properly. I mean, I can do it. We did a lot of hands on. And she said, I was not even knowing how to hold the syringe in the right way. Okay.
Understood.
And when we talk about, say, for example, in injectables, we just talk about fillers. So general conception is that fillers is hyaluronic acid. So we call fillers hyaluronic acid as fillers. But fillers, there are so many different types of fillers. For example, hydroxyapatite. This is something which we are already using for sinus lifts,
Yes,
for
yes.
when
Graftings.
we are removing cysts for, yes, graftings and all. So hydroxyapatite is a product which is our product in terms of we understand and know hydroxyapatite very well. Like teeth is hydroxyapatite. Then we have polylactic. That is another filler, and these fillers are usually done with cannula techniques, pan facial, like full facial. And then we have different biorevitalization fillers. So fillers alone is a like huge topic. Okay.
Understood.
Then we have neuromodulators, which we generally call as Botox in lay term, like, or Botox is a company name also. So we neuromodulate. We basically modulate the functioning of this area so that our joint remains healthy, our muscles are in harmony, we don't get myofascial pain, or we use it for bruxers and such. So then we have threads, which are again regenerative, which make new collagen. There's quite a lot in injectables, quite a lot.
Understood.
So to be just saying the word just injectables is not fair. Of
Sorry, sir.
course, when no, it's not about sorry. It's about knowing. See, we are learning. All of us are
Yes, sir.
learning. The most important thing is that whenever there is a confusion about certain things, the most important thing is to first sit down calmly and understand things. This is what we are doing. We're trying to understand and rationalize using a certain thing. And see, dentistry or whatever field of medicine there is, or whatever there is in the world, may it be cell phones, may it be everything has to evolve and expand.
Understood.
We cannot regress we cannot regress when implantology came in, initially there was also a lot of hue and cry about general dentists not being able to do it. Anyways, that's we are beyond that point now.
Understood.
Every general dentist
So
can do
now,
it.
when you're
But
talking
then,
about these injectables and everything, in tier one cities, we usually find these kind of patients. That is what the perspective is among dentists. So, what is
uh-huh, uh-huh.
your opinion about doing these in tier two cities and everything? And how do you make the masses understand that we are not just doctors of teeth, but we can treat all
Mhm.
this? So, how do you get this point across to the masses? And can this be done in tier two and beyond cities? If you like this video, please do not forget to hit the like button below. And I'm sure you're subscribed to our channel if you're keen on taking your career after BDS to the next level.
I love to live in tier 2 and tier 3 cities. I love it. I don't like going to tier 1 cities. I've been
Okay.
working everywhere in tier 2 cities only. I mean, I would feel that it's a waste of time for me to live in a tier 1 city for doing these procedures. I never like, okay, I have sometimes workshops, yes, but I'm sitting in a tier 2 city.
So, how do you find
No
patients for
question.
this? How do you convince patients that we are the ones who can treat them better?
See, actually, what happens is it goes both ways. When the treatments become popular, the patients will find you, and when something is new, you will find the patient. That is how it is.
Yes,
Okay.
sir.
So when I started doing this, it was a little bit tricky because people did not have much awareness, and people from these tier 2 cities used to go to tier 1 cities to get these procedures done. They used to be a thought process that this is for celebrities, okay, and
Yes.
and just people. But now everything is for everyone. Social media has made stars out of ordinary people. Everybody wants to look good and everybody understands. Like, quite a lot of people now come by themselves, you don't need to tell. And I've seen this whole change happening in my career because I started quite early. Now I don't have to go and find. Now people know it, they want
Okay.
to get this, they understand it. Because with the social media, you know we are like one. Okay, there is no
Understood.
tied to entire one city. Yes. And
Understood.
if
So the
you ask
knowledge
me
is spread
personally,
faster.
besides, yes, besides this discussion, I mean, frankly speaking, I don't want to sound very loud, but it's a nightmare to live in a tier one city now. Like, if you
Understood.
honestly, like, if I would be, it's crazy, So people, and see, it was 10 year, 15 years back that Bombay was Bombay or Delhi was Delhi. It was
Understood.
special because you would never get
Those things
those
in tier
things which
twos,
you would
tier
get
three
there.
cities. Now
But
you get
now
it everywhere.
everywhere, everything is there. Yes, yes. Social media is everywhere.
Understood.
Yes.
So one way we
Mhm.
can use
Mhm.
social media to leverage and tell the patients that we do these procedures. Second is initially we
I
can tell our patients and later they themselves will flock when we deliver those goods.
absolutely, and you will be surprised, that you will, when you like start learning, like when you do it, you'll realize, oh my God, this is just a part of what I do, like every day. I mean, I'm
Understood.
taking photographs of patients, extraoral photographs and intraoral, and then I'm examining the patient. And so many patients have myofascial pain and such. So you'll be surprised at how much is it sort of related to us. You
Okay.
understand? Like
Understood,
how
Rajat.
easy, like how every patient is like a patient sort of for the patient who walks in.
Understood. Because you start looking at it that aspect. As of now, when they see patients, they do not
Absolutely,
realize these
yes,
procedures are
absolutely.
required. It's basically
See,
the
whatever
I see
actually
what
when
you
we,
know.
absolutely. And secondly, what we perceive as cosmetics is something else. In terms of, we try to think of lasers, for example, or we, you must be seeing a lot of social media pages. A lot of people just keep on showing about PRP, or very few people are there who actually put up their cases, before after pictures, for example, or so first of all, understanding your scope of practice is important. What is my scope of practice? For example, you're a periodontist, so you might have learned implantology in your college only. Okay,
Yes.
might not, might be, or might be not. I learned implantology after I finished my education, because it was not there. I learned lasers. I'm working with hard and soft tissue lasers both. I
Understood.
mean, I learned about lasers. I had to make an effort because I wanted to expand my scope of practice. So Dr. Rajat also works with lasers, but he has to learn that skill of working with lasers. My degree is enough. Okay. My degree is enough. Now I have to be a lifelong learner on the procedures I want to do. If I don't want to do, if I don't want to do lasers, okay, I will not learn it. That's my choice. I have to clear my exams, have a certain standard, fill cavities or do root canals or whatever. And I have a choice, which every profession has, to upgrade myself. So you chose to maybe just go in implantology. You learned a little bit of implantology in college. Then then you finished, then you did few cases. Then you must have done learned about soft tissue grafting, or
Yes, yes.
lasers, for example. So our scope of practice will keep on increasing.
Understood.
If I tell you from an example of a radiologist who finished their post graduation maybe 15 years back, there were no PET scans, for example, at that point of time. No MRIs were there. They are doing it. I mean, they are reporting it. They learn it. So you have to learn
Understood.
what you have to learn. And if you don't learn what you don't want to learn, it's up to you to enhance your scope. So a lot of people think that we have to have a degree in this. It's strange because I would not. Would somebody take a degree in PET scan? I'm just
No,
asking. Like a radiologist take a degree in PET scan? No.
of course not.
Huh?
Of
No, they
course
will
not.
not. They just learn it and do it. Will I take a degree in giving local anesthesia? No. I mean, I've done my things and I have to expand my practice. There is no more. There is no degree other than BDS or MDS degree in India. Nothing
Yes.
else is that way recognized as a dentist. And it's right. It's for other degrees also. There are programs which have certain standards. For example, for implants, there is ICOI, they have fellowships, it's like that.
Understood.
So having that kind of mindset also is feels a little strange, feels very unscientific, to be honest. And it's
Understood.
not wrong, it's not wrong. The problem is that when we enter college, when we have initially we should have an orientation week, for example. See, if I ask fresh pass outs about medical devices, needles are also medical devices. We don't know
Yes.
anything about it. We don't know about our instruments that well. We don't know where the definition falls. Then, if you see, we will get our car insurance done, okay, but we won't get our indemnity insurance done. You understand?
Understood.
So, and it's not, I'm not saying that people are wrong or dent no, it's their fault. No, it's the fault of the system.
Understood.
It's the fault of the system. If why UK people are taking out letters and distributing them, mailing them dentists that listen, this is your scope of practice, this is your document, these are your guidelines, right? I mean, we should
Yes.
also have it. Why not? And if they can do it, if they can do it, what is wrong with our teaching then? Where we lack
Understood.
in our teaching, if other countries can do it, why are we not talking about it? And then there is a confusion, and then there is no answer for from anywhere. And then people who don't do it on time, they would lose out, obviously, because in the beginning they'll become pioneers, people will become pioneers, right?
Got it.
And then when
Yes.
everyone will do, then everyone will do because everyone is doing.
Got it.
Yes,
So if
yes,
you are
yes,
want to be there, you should be
absolutely.
among the starting people out there, and you should even know your scope, whether it falls in your scope. So if
Yes,
it falls
it's
in your scope,
see,
you should continuously grow in that direction.
if I feel like if I want to work with fillers, if I want to work with implants, or I want to, and I have interest, why not? If I
100%.
don't have interest now, yes, you can have a consultant come in and do fillers for you, for example.
Understood.
Mm-hmm.
Got that, sir.
Mm-hmm. Mm-hmm.
So now we
Yes.
know you have been taking a lot of courses across India, Europe, everywhere. So if someone
Mm-hmm.
wants to join one of them, how do they contact
Mm-hmm.
you and how do they get hold of the details?
Yes. So you
Sure.
can even share my Instagram page. I put a lot of videos there. They can have a look at the videos. I post quite a lot of live videos also. And I believe there is only one way of learning, and that is through hands on, okay, through working on patients. Mm-hmm.
So it was amazing
Yes.
having you here today. And I'm sure a lot of people who were at the line, not sure what they can do, what they cannot do in
Mm-hmm.
cosmetology or facial cosmetology, what it is called right now, would have got a
Mm-hmm.
overview about what they should get into. Thanks a lot, sir. Thank you for
Yes,
taking your time and
absolutely.
joining us
Yes.
today.
And thank you so much for taking this initiative also. This is really good that you're creating a platform where people would, get to know things for which there is a lot of chaos and confusion.
Yes, sir.
Unfortunately, it is like this. It is like this. We can't help it, but uh, people
We should
like
find our own
you
path.
who take the initiative, yes, and take out time and, put the information across people. It's a blessing for, it would be a blessing for a lot of people, trust me.
Thanks a lot, sir. Thank you for joining us.
Take care. Take care. Thank
Thanks.
you so much. Bye bye. Bye.
If you have seen this video and not seen our video, Facial Cosmetology after BDS, do not forget to go and check that out. If you're interested in aesthetic options after dentistry, go and check our video about that as well.